Hi, this is Dr. Brittany Todd, and I am a pharmacist and a mother. And I have a friend who called me this morning because she has a 15-month-old baby who is just sick. She has a fever of 102.8. She is clingy. She is tired. She feels awful. And the mom said, well, I gave her ibuprofen this morning at 2 a.m. I don't understand why her fever is still just so high. And I said, well, have you given her anything since? It's now 7:45 in the morning. And she said, no, I'm waiting the 6 hours, which is true. So ibuprofen should be dosed every 6 to 8 hours, and acetaminophen should be dosed every 4 to 6 hours. So I just think both of them every 6 hours. It's just an easy common denominator. But if you wait the full 6 hours to dose the next medicine, sometimes the fever starts coming back up and you start feeling miserable around 4 or 5 hours. The medicine doesn't quite last that long for some stubborn fevers, some that works just fine. But if you have a stubborn fever where the baby's starting to, the fever's starting to creep up, they're feeling miserable again, you can actually alternate the medications every 3 hours as long as you're alternating between medicines. So ibuprofen has to be dosed 6 hours apart from itself, and acetaminophen has to be dosed 6 hours apart from itself. So if you give ibuprofen at 9 a.m., you can't give it again until 3 p.m. But you can give the acetaminophen right in the middle at 12 p.m. and then again at 6 p.m. So they're still getting medicine every 3 hours, but the ibuprofen is not any more frequent than 6 hours, and the acetaminophen is not more frequent than 6 hours. So that way, if you have a stubborn fever, you don't even want to give it a chance to get as high as it does, because then the kid's just miserable, not eating, not drinking, just feels awful. So she texted me about, 3 or 4 hours after we talked, and she sent me a video of her daughter who's playing, because she finally feels better because she has the medicine keeping her fever down, and now it's like 99.1, and she feels so much better. So the every 3 hour dosing is great. It is sometimes hard to keep track, so that's where I recommend the Pain and Fever Dosing Guide for Infants and Children. This is available on Amazon. In the back, there are 20 of these dosing charts. And you just track your child's medicine. So you put their name, their weight, the date, and then you write down, oh, I gave acetaminophen, this is the dose and this is the time. And then you can know that the next dose due is ibuprofen, that's the dose and at what time. It helps you track which alternate dose you're on. So I highly recommend this dosing guide for not only tracking your kiddos' medications, but also just understanding that every 3 hours can help reduce and keep that fever nice and low and make your babies feel so much better.